Welcome to Need Guidance. Hamstring muscles and popliteal fossa and popliteal artery. Starting with the hamstring muscles. Hamstring muscles, the common characteristic is that it has a common origin, common insertion, and common nerve supply. Starting with semitendinosus, we can see in this diagram it has the origin from the ischial tuberosity along with the long end of the biceps femoris, and it is inserted on the tibia. Its nerve supply is tibial part of sciatic nerve. The root values are L5, S1 and S2. The next is semimembranous. It takes origin from the upper lateral part of the quadrilateral area of ischial tuberosity and inserted on the tibia. Its nerve supply is its insertion is the horizontal groove on the posterior aspect of the medial condyle of the tibia. Its nerve supply is tibial part of the sciatic nerve. That root values are L5, S1 and S2. We can see that both have the same nerve supply and same origin, that is the ischial tuberosity, and inserted on the tibia. Nerve supply is from the tibial part of the sciatic nerve. And the actions, these muscles are the chief flexors of the knee joint and they are the weak extensors of the hip joint. And hamstrings are the hip extensors during walking. It restricts the range of the motion of the hip flexion. When it comes to the clinical significance, in case if the hamstring muscles are paralyzed, the patient tends to fall forward because that gluteal maximus muscle cannot maintain the necessary tone to stand upright. It's all about the hamstring muscles. This origin, this is semitendinous, origin, insertion, nerve supply, and semimembranous, origin, insertion, nerve supply. Next is the action you can go through. And next is the clinical significance we have completed. Next is the popliteal fossa. I have tried to put all the information in the single diagram. First, coming to this definition, we have know that a popliteal fossa is a diamond shaped fossa. And the relations we can see in diagram, I have tried to put superior-medially we have semitendinosus and semimembranosus. Superior-laterally we have biceps femoris, and inferior-medially we have medial head of gastrocnemius, and inferior-lateral we have gastrocnemius and plantaris. Coming to the contents, we have common peroneal nerve. Next is from medial to lateral we have the common peroneal nerve. From medial to lateral we have the artery, vein and nerve, and the contents are those. We have a popliteal pad of fat. We have popliteal artery, popliteal vein, and these popliteal lymph nodes. Coming to the relations of the artery, vein, nerve. In the upper part we have first is from medial to lateral we have artery, second is the vein, and third is the nerve. In the medial part, in the middle region, we have some superficial to deep. First is the nerve, second is the vein, and third is the artery. In the lower part, we have from medial to lateral. First is the nerve, second is the vein, third is the artery. Here we complete the first the definition. Second is the relations. Along with the diagram we can predict, and third is the content. Mainly content we have popliteal artery, popliteal vein, and now popliteal pad of fat, and the popliteal lymph nodes, common peroneal nerve. And next, coming to the definition, it's the continuation of the femoral artery. It begins at the adductor hiatus, crosses the floor of the popliteal fossa from medial to lateral side, and it lower border of the popliteal, it divides into anterior and posterior tibial arteries. Its branches are cutaneous roof of skin. It has mainly three branches. One is the cutaneous, muscular and genicular branches. Cutaneous is it supplies the roof and skin. Muscular we have two branches. Once again, upper branch and the lower branch. In upper branch we have two branches we supply adductor magnus, and second one is the hamstring muscles. In lower branch it supplies the triceps soleus muscles, that is two heads of gastrocnemius and soleus and plantaris. Genicular branches we have superior, medial and lateral, and inferior medial lateral, and next is the middle. In superior medial genicular artery, superior part we have medial genicular artery and a lateral superior genicular artery, which will both anastomize around the femur. And the lower part we have lateral medial inferior genicular artery and lateral inferior genicular artery. These both will anastomize and form the genicular anastomosis. Then the third middle genicular artery It will supply the cruciate ligament and synovial membrane. Relations are anterior, it is the floor of popliteal fossa, posterior it has popliteal vein, tibial nerve, fascia, roof, and superficial fascia, the skin. Clinical significance of popliteal artery. It is more prone to aneurysm than any other artery in the body. It presents a pulsatile midline swelling in the popliteal fossa. And second is that Baker cyst. It is the inflammation of synovial bursa. Popliteal pulse. It is the when you flex the knee and relax the fossa, we should place the fingertips, both hands in the popliteal fossa with thumb resting on the patient's patella, so we can feel the popliteal pulse. Next is the Trendelenburg sign. We have two cases. One is a normal one and is a paralyzed. In normal cases, the gluteal medius and minimus prevent the unsupported side of the pelvis from sagging during walking, so that normal level of pelvic is maintained, provided by the hip joint and neck shaft angle of the femur are normal. In case it is affected, like it is paralyzed due to injury to the superior gluteal nerve, there is paralysis of gluteus medius and minimus. The pelvis sags on the healthy side of that foot if that foot is off the ground. A person walks with a arching gait. It is clinical known as Trendelenburg's sign. It's all about hamstring muscles, popliteal artery, and Trendelenburg's sign. Thank you. Good luck for your future.